Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Hello, everybody. I am Professor Rida El-Badri, Professor of Neurology, Asyut University, Egypt. I am a fellow of the American Epilepsy Society and the American Academy of Neurology. Today, I'm happy to be with you in this webinar sponsored by the International League Against Epilepsy in the Middle East region. And I am very pleased to introduce my colleague, Professor Rehab Magdi Hassan, Assistant Professor of Neurology, Neurology Department at Faculty of Medicine, Cairo University, and a member of the Epilepsy Unit of Cairo University. Dr. Rehab, thank you for your help and your lecture. And now we will open the floor for your lecture.
Thank you, Mr. Thank you. Bismillahirrahmanirrahim. Hello, everybody. I'm Dr. Rehab Magdi, Assistant Professor of Neurology at Cairo University, Epilepsy Unit. Today, I will talk about Ramadan fasting and epilepsy, what neurologists should know. In our lecture, we will try to answer some questions that are frequently asked by Muslim patients with epilepsy. Is it safe to fast Ramadan? What about anti-seizure medication management during Ramadan? Can some types of seizures improve by fasting? The post-fasting effect of Ramadan? And finally, is it safe for children or adolescents with epilepsy to fast or not? First, a neurologist should reassure their Muslim patients with epilepsy that most of them can successfully complete Ramadan fasting without any breakthrough seizures. Here, this is our first publication by Cairo University Epilepsy Unit about Ramadan fasting and epilepsy. In this paper, we studied about 430 Muslim patients with epilepsy to detect predictors or risk factors of successful Ramadan fasting, meaning Ramadan fasting without any breakthrough seizures. We found that most of them, about 75%, completed Ramadan fasting without breakthrough seizures. We found that there were some modifiable and non-modifiable risk factors of fasting-related seizures. Let's start with the non-modifiable one. They include age, disease duration, seizure type, and metabolic derangement or electrolyte disturbance caused by fasting. In our paper, we found that only younger age and shorter disease duration were significantly associated with successful Ramadan fasting. What about modifiable risk factors? Of course, they are the most important, and as they are factors that can change or modify. They include sleep deprivation. All we know that Ramadan can cause sleep disruption in Muslims, either because of delaying suhoor meal just before Fajr or due to praying for long hours at night. Also, we had seizure control. We mean the longest seizure-free period interval before Ramadan. Also, we had some anti-seizure medications related factors, including timing of taking medications, half-life of medications, and some pharmacokinetics considerations. In our paper, we found that sleep and seizure control before Ramadan were the only predictors of successful Ramadan fasting. We found that every extra week of seizure freedom before Ramadan was associated with a 10% increase in a probability of successful Ramadan fasting. It means that every extra 10 weeks of seizure-free period before Ramadan was associated with 100% increase in the probability of successful Ramadan fasting. Likewise, the sleep. Every extra hour of sleep was associated with an increase in the probability of successful Ramadan fasting by 30%. It means that every extra 3 hours of sleep was associated with increase in the probability of successful Ramadan fasting by 90%. But how this could be clinically applied? Let's see. In this clinical scenario, we had a Muslim patient with epilepsy presented to us, hoping to fast next Ramadan safely, as he experienced a breakthrough seizure during the last Ramadan. By asking him, he had a seizure-free interval before the last Ramadan, about 4 weeks, 1 month, and he used to sleep about 5 hours during the last Ramadan. Let's apply the hour rule. As we said that every extra 10 weeks of seizure freedom before Ramadan would increase the probability of successful Ramadan fasting by 100%. So 10 weeks plus the 4 weeks equals 14 weeks. So we had to do our best to control our patient about 14 weeks before the next Ramadan for his safety. Regarding sleep, by referring to our rule, we said that every extra 3 hours of sleep would increase the probability of successful Ramadan fasting by 90%. So 3 hours plus the 5 hours equal 8 hours. So we had to advise this patient to sleep at least 8 hours per day for his safety. Now we had also anti-seizure medications related factors. Neurologists should gradually adjust dosing timing before Ramadan with an appropriate period to reach the required timing that must be followed during Ramadan to be closer to the timing of iftar and suhoor meals. Let's take a clinical scenario. If we had a Muslim patient with epilepsy presented to us hoping to fast the next Ramadan safely, he is on valproate and levetiracetam twice per day at 12 p.m. and 12 a.m. What shall we do? We will gradually adjust the timing of medications to be closer to timing of iftar and suhoor meals, nearly at 6 p.m. and 6 a.m. instead of 12 a.m. and 12 p.m. The most important thing that this adjustment or modification must occur gradually and at the month preceding Ramadan. Please don't wait to do this modification at Ramadan. Also, we had the half-life of anti-seizure medications. Of course, the previously mentioned adjustment would apply to drugs with short or intermediate half-life, as no fear with drugs with long half-life. Another solution for short half-life or intermediate half-life is to use the XR or CR formulas. Regarding pharmacokinetics, It is better to use or to take fat-soluble drugs including phenytoin after meals and water-soluble drugs as valproate to take before meals. Now, the next question, can some types of seizures improve by fasting? This is the second publication by CUEU regarding epilepsy and Ramadan. In fact, we were surprised that we found that some seizure types improved significantly by Ramadan fasting, including focal seizures, myoclonic seizures, and absence seizures. Also, we were surprised that we know that Ramadan had a post-fasting effect, meaning that this improvement extended beyond Ramadan to be noticed also in Shawwal, the month immediately following Ramadan. We tried to explain this finding as Ramadan fasting can increase BDNF and some neurotrophic factors, including insulin-like growth factors. Ramadan can improve neuroplasticity and improve mitochondrial function, reducing the oxidative stress and also cause balance in glutamate and GABA ratio. Now, is it safe for children or adolescents with epilepsy to fast? This is our most recently publications about Ramadan and epilepsy. It is not published yet. However, I would like to present our findings, as many parents of children with epilepsy are so afraid about the effect of Ramadan fasting on the seizure frequency of their children. We found that focal onset seizures and generalized non-motor seizures or absence seizures were significantly improved during Ramadan. So we had to reassure parents with children with epilepsy that there is no fear of fasting during Ramadan. And even we can encourage them to fast Ramadan, especially children with focal onset seizures and absence seizures. At conclusion, I would like to summarize our lecture and some key points as recommendations for Muslim patients with epilepsy before Ramadan fasting. Number one, reassurance that most of them can successfully fast Ramadan without breakthrough seizures. Advise them for adequate sleep hours during Ramadan, a proper seizure control before Ramadan. For patients with DRE, is it better to avoid fasting? Gradual adjustment of dosing timing before Ramadan to be closer to suhoor and iftar meals. Use of XR formula of drugs with short or intermediate half-life. Take fat-soluble drugs after meal and water-soluble drugs before meals. No fear of gradually training children or adolescents with epilepsy to fast. Muslim patients with epilepsy with focal myoclonic absence seizures should be encouraged to fast because Ramadan has an improving effect on these seizure types. Ramadan had a post-fasting effect that could be extended to the month following it. Thank you.
Thank you, Dr. Rahab. A very nice lecture. Thank you for your help. Good. conclusive.
Thank you, Doctor.
And you
Thank you,
make it
Doctor.
as a series. So you have more than one paper about that.
Yes.
You have more than one paper. That's good. Why didn't you think about making all the papers in the same journal? I can see one of them, each one of them for each for different journal. What is the reason for that?
We tried first in Seizure journal, and it would be accepted. The second one about fasting effect and post-fasting effect.
Yeah.
Regarding improving of seizure types, we would like to separate this finding in a single paper, because we were surprised that Ramadan fasting improved some seizure types.
The question is that if I am responsible for some journal and I have a new idea about something, and the researcher is trying to cover many aspects about the same idea, it's better for the journal to have the same researcher having different researches to be in the same what can I say, in the same journal. That's it. This is my question. So the floor is now open for all the participants to ask their questions. Please add your question to the Q&A chat box, and we will ask the speaker about it. Okay, we will take the questions which are related to the topic of the lecture. So please be confined to the topic of the lecture. My first question till our colleagues write their questions is for you. What do you think about the duration of the last seizure? That what can I say? If a patient is coming to you just before Ramadan, like in Shaban, and he has seizure during Shaban, will you advise him to and help him to fast Ramadan, or it will be difficult for you?
Okay. First, we would reassure this patient that and told them that a proper seizure control about every extra 10 weeks would increase the probability of successful Ramadan by 100%. Now he is coming during Shaban. So this I can't do anything in this situation, but I can modify sleep. At
He will
least
ask you for the fatwa. This is the problem. Usually the patients ask us for the fatwa for having Ramadan fasted or not. This is a problem. Most of people don't come before Ramadan fasting by a long time. Most of them come just 2 weeks, 1 week before Ramadan, and I want to fast next week. And what to do?
I said to him that there is a risk, as he had a seizure during Shaban. But what can I do now in this situation is sleeping, is advice about adequate sleep.
Okay. So we have a question here from Dr. Turkomani. He is asking you about the sample size for the study, about the study of children and adolescents with epilepsy.
Yes, the sample size 120 adolescents with epilepsy. About 120.
120.
Yes.
Okay. This is in the study of adolescent and children, or in the first study, the general one?
Adolescents in epilepsy, 120.
And what about the first research, the first study?
The first research, 430.
430. Okay. So we have also another question about that. Someone is asking about the polytherapy and monotherapy. What do you think about that? If some patient have more than one drug and another patient have monotherapy, which one do you prefer?
Of course, monotherapy is associated with with better outcome regarding fasting. But we tried to use long half-life medications or XR or CR formula. as we can. Yeah.
Okay. What will you do with patient with medication every 8 hours, for example? Like those drugs with short half-life, as you said in your research.
Okay, we divided the daily dose into two doses and try to make the timing of medications just close to iftar and suhoor meals. But this should be done before Ramadan, gradually.
The duration of graduation, Dr. Rahab,
Mm.
how
It,
do you
it,
do this? For example, if you want to change the time of dosing, do you see?
yes,
To make it at suhoor time, just before Fajr prayer, and at
yes.
Maghrib prayer. So the graduation of dosing, how do you do?
Actually, we didn't study this point in our paper, but I think that every 1 week we can change or move by 2 hours or 3 hours. But this is my clinical sense, but not يعني on research base.
Okay. So also we have another question about the epilepsy triggers uh, during fasting and the correlation between brain and the fasting or empty stomach. Here in empty stomach, I want to add something to this question because some of our drugs are better to be given on empty stomach and others are better to be given on full stomach. What about this question?
Yes, we said that fat soluble drugs is better to be taken after meals, especially iftar meals, as some Muslims prefer to have heavy meals at iftar. However, water soluble drugs could be taken before meals.
Okay, so you ask the patient, if my understanding is true, you ask the patient to make the last dose just before Fajr prayer after having suhoor meal.
Yes,
And the next dose will be just after Maghrib azan or prayer, before meal or after meal. What do you think?
before meal or after meal, according if this drug is water or fat soluble drug. Water soluble drug is preferred to be taken before iftar meal, while fat soluble drug is preferred to be taken after iftar meal.
Okay, we have a direct question from Dr. Talib. He is asking about fasting itself. Is it protective against epilepsy or not?
Yes, we found that epilepsy itself could improve focal and absence seizures, especially.
Yeah, yeah. And I think there is some change in the second paper about adolescent. The myoclonus was not present as it was present
Yes,
in the first,
the
yeah.
lycoma was not improved in the second page.
Okay. Okay, Dr. Lemo, he's asking about diet or nutrient. Do you need any adjustment during Ramadan period? I'm
Try
not sure if he is asking about the type of food or something like that. I'm not sure.
we didn't study this point in our paper. However, we advise Muslim patients to take dates at suhoor to keep the serum blood glucose constant all over the day, as Sunnah
Yeah.
instructed us.
Okay. Okay. Dr. Nermeen Keshk, she's present with us and she told us that we can shift the time for 2 hours earlier or later. Dr. Nermeen, I'm not sure if you are asking or you are giving an answer. You are welcome, Dr. Nermeen. Okay. Here, Dr. Wael is asking about what is the definition of controlled seizure to be candidate for fasting. I think the condition is related to the definition by time, as you said before.
Yes.
Mm.
There is no universal definition for seizure control before seizures.
Before
Every
fasting.
patient, before fasting, every patient has its own seizure control every extra week.
Okay. But also we can say that there is individual variation between every patient. Yeah. Some patients who are having, what can I say, a lot of breakthrough seizures previously, I think those patients are not eligible to do fasting because the risk of recurrence or breakthrough seizure will be high. There is
Yes,
a doctor, he is asking about after finishing of Ramadan fasting, how to come back to the usual dosing regimen. Will you go through the same schedule by changing the time of dosing gradually, or you will keep him if he is controlled during Ramadan and there is nothing, there is no problem?
no, I will keep on this timing. I will not
Okay,
change.
okay, okay. Do you think there is any rule of good hydration, Dr. Rahab? What can I say that? Do you ask the patient to have a lot of water, for example, at suhoor meal to help the patient to be controlled? You know that the dehydration is one of the most important risk factors
Yes,
of seizure occurrence. So do you ask the patient to take some sort of fluids or something like that?
of course. And avoid hot weather if Ramadan comes in summer, especially if we deal with elderly.
Yeah, yeah. Dr. Tariq Amir, he is asking about the intermittent fasting. Can it improve the seizure control in adolescent or pediatric patients? Do you think so?
Yes, I read a publication about this issue as ketogenic diet, as we all know that is one of the established treatment for the drug-resistant epilepsy. And as also we found in our study about Ramadan that some seizure types would improve. Some authors thought about intermittent fasting, taking the benefit of intermittent fasting without dehydration. So they advise Muslim on so they advised patients with epilepsy for intermittent fasting about 16 hours, but free water is allowed. So they take the benefit of intermittent fasting without the risk of dehydration, and they found some improvement in seizures.
Okay. But my concern is about this intermittent fasting because the dosing time will be to some extent disturbed. If you ask him to fast, for example, for 2 or 3 days or Monday and Thursday fasting as we do in Sunnah, I'm not sure about that. If 5 days of the week we will take the dose, for example, 12, but in Monday and Thursday, it will be different. I'm not sure if this will be good choice or not. It's okay. Dr. Turkomani asked you again about if there is any genetic epilepsies in your studies.
Yes, in the first study, we had most of them were genetic generalized epilepsy. Maybe for this reason, sleep was found as a predictor for seizure control, as these epileptic syndromes are very sensitive to sleep deprivation as a trigger for seizures.
Okay. Okay, we have Dr. Tariq Amir. He is asking about the relation between ketogenic diet and epilepsy because some people use it, this ketogenic diet, as a treatment option. So he is asking if fasting acts as a method of having ketogenic metabolism.
Yes, but in a different way. Ketogenic diet is a high fat, low carbohydrate. But Ramadan, as Muslims, we are free to eat anything from المغرب to الفجر without
Yes.
any restrictions.
Yeah.
So exact pathophysiology is different from these types of fasting.
Okay. So Dr. Wael is asking about the number of cases of secondary epilepsy. Do you recommend the drug level monitoring to allow the patient to fast or not?
Serum level to fast, no,
That's to say,
no.
if you find the patient with a serum level in the therapeutic range, you will allow him to fast. And if you don't find it, you will not allow him to fast.
يعني if I found a sub therapeutic level, I would increase the dose, of course, for his safety, regardless of Ramadan or not.
Okay. So we have a usual question given by the patients to us if they ask about fasting Ramadan. They said that I will try to fast by your regulations and your advices, but what will I do if I have a breakthrough seizure? What is your advice for such patients?
Uh, some are excused to break his fasting at this day.
And the complete fasting the rest of the month or to stop fasting this year? It's a fatwa. That's why I'm asking you. That's why I'm asking you.
I couldn't.
But in a fatwa, let me tell you something that some of the religious people and the spiritual people ask the patient to ask his doctor. And the doctor here is playing the role of both religion and medicine. If you find this patient to have his life supposed to be in danger, you should keep his life. This is muqaddam. This is more prior to fasting. So for my experience and in my practice, if some patient ask that I want to fast Ramadan, I gave him the regulations. I agree with you totally. But I told him that if there is any breakthrough seizure or just the aura, you feel in some patients have some aura. If you have the aura, please cut your fasting, and it's not allowed for you because your life is a priority for me more than fasting. This is my opinion, and I'm not sure if you have the same or not. Okay.
Difficult question. I leave
Yeah, of course, it's a
for
difficult,
fatwas.
it's a corner question. Okay, Dr. Tariq Amir, again, he's asking about why some researchers think some of the biggest risk during Ramadan might come from changes in timing of when taking epilepsy medication and having disturbed sleep. I think both items are very important. The thing is that most of the Muslims in Ramadan are keeping on Fajr prayer. That's why most of them do not have enough time for sleep.
Yes.
It is advisable for the patient to have sleep before Fajr prayer and then wake up for Fajr prayer and have 1 or 2 hours after Fajr prayer and then go to his work. This is better because both sleep deprivation and the timing of the dose are two factors. They are confounding factors. Maybe the danger is from the sleep deprivation more than the timing of the dose.
Yes.
Okay. Dr. Wael is asking about pregnant women with epilepsy. I'm sorry, Dr. Wael, please don't say epileptic patient. It's a patient with epilepsy. What about pregnancy, fasting, and the epilepsy? The triad. What do you think, Dr. Dua? Dr. Rahab.
لا, we advise them not to fast.
So for pregnancy, you feel it is extra risk.
Yes, extra risk.
Okay. 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 So I'd like to ask you something. If you have a patient in a case on a medication that is in IR, immediate release, will you change the same drug if it is available in a format of sustained release, extended release, continuous release, the same drug, or you prefer to keep on if the dose is twice per day? For example, levetiracetam. Here in Egypt, we have extended release preparations,
Yes.
and we have IR, immediate release. If a patient
Yes.
is on IR every 12 hours, will you change it to XR or not?
Yes, if he can afford to buy XR, yes, it's better to use XR. Because levetiracetam is has a short half-life, not intermediate.
Yeah.
Short half-life, about from 7 to 10 hours. So it is better to take it XR or formula.
With the same amount. For example,
Yes,
1,500 milligrams will be the same.
yes, the same amount.
And will it be at Fajr and at iftar time, or it will be once per day?
And either, you see, either can be.
Okay. So Dr. Anas El-Junaidi is asking about the nasal anti-seizure medications. Up to this moment, we don't have in Egypt, but I think it is present all over the world. I think something is called Valtuku. It was clonazepam, for example. He is asking about its role in fasting. What do you think? Well, the thing is that the nasal drop itself and the eye drop itself has some problematic rule in Ramadan fasting. It's up to you. What do you think about nasal anti-seizure medication?
No, nasal anti-seizure medications would break the fasting. It's not
And
allowed during fasting.
I think all the medications that can be given intranasally are benzo. To my experience, I don't know that if there is, for example, sodium valproate or levetiracetam or brivaracetam that can be given intranasally. I think it was only the benzo, isn't it? I think benzo. Do you have any patient on benzo only?
No, benzo only, no.
Yeah. We use it just in acute stage.
Yes.
Okay. So in our question and answer chat box, there is nothing more. Jessica, do we have anything else about the questions?
No, thank you so much.
Okay, so to conclude, Professor Rahab Magdi gave us today a very nice, concise lecture, including more than 3 researches trying to put the spotlight on the relation between Ramadan fasting and patient with epilepsy in our region or all over the world, Muslim peoples. For me, it was surprising, really, that some of the seizure types like focal seizures, myoclonus, and the absence are getting better regarding their control during fasting. And she put some regulations about the rules that should be given to the patients before Ramadan fasting. And we should ask the patient all over the year during their follow-up with us in the clinics, if they want to have Ramadan fasting, they should start before Ramadan to regulate their doses and to change the dosing time gradually to allow them to have Ramadan fasting. I'm very pleased to be with you today, Dr. Rahab. Thank you so much for your nice lecture. It was very good for me and impressing. Thank you for the audience. At the end of the lecture, we reached about 86 participants all over the world. This is very 87. This is very nice. Thank you, Jessica, and thank you for all people in the International League Against Epilepsy. I'm very happy to be with you today.
Thank you, Dr. Professor Rida Baki, for your nice collaboration. Thank
you.
you, Jessica, for your invitation. Thank you, the audience. Thank you.
Thank you.